Well, a warm welcome to this talk. It's Saturday the 29th of January and it's a windy day in the north of England. Now, I've got some serious things to talk about today as regards the BA.2. But before we do that, we're going to have a little sort of light distraction because I've come in for the attention of an organisation called the, what was it called again? I think it's called the BBC. I have heard of it before. They've done a bit of a thing about me here. Apparently I seem to have been saying various things. We'll have a look at it. But it's been labelled as false. Of course, I did not say 6,000 people had died from COVID. This is simply laughable. And here is the BBC article. Of course, I'll put the website on. You can look at it directly. That's actually quite interesting. Let's have a look at it. COVID post claiming only 17,000 died of virus is factually incorrect. Correct? That is factually incorrect, as I believe I've been saying all the way through this pandemic. But of course, you'll have to decide that for yourselves. So reality check. Sounds good to me. We all want reality, don't we? So reality is brilliant. Then on the 20th of January, Dr. John Campbell, a retired nurse educator who has amassed a huge following on YouTube. Well, it's kind of you to say so, BBC. I'll give that a tick. Released a video describing the figures as a huge story. Now, to be fair, I did say it is a huge story, and it is. Okay, looking back, I might have said a big story. But the point is, at the time I published this video on the 20th of January, I saw no mention of this figure at all in any of the mainstream media. That probably just missed it. If it's been in mainstream media, do inform me. I don't get everything. So yeah, I did say it was a huge story because it is quite a big story because this is about human pain, suffering, and death, and that's why we do what we do. And suggested COVID-19 deaths were much lower than the mainstream media seems to have been intimating. Well, did I suggest this? Let's just look at the data I actually used in this video here. So here we have this data I used here. We'll do the survey later. Coronavirus COVID-19 latest insights. So we used that data there from the where's that from? Oh, that's right, Office for National Statistics, which of course is the most definitive source in the country by a long way, as everyone would admit. We use the Office for National Statistics data. We also use this information here, deaths in the UK. This is from an organisation called, what's this one? Oh yeah, UK Government. So that's from an organisation called the UK Government, where there's a lot of official data as well. So we used that site as well. This is the actual Freedom of Information request, I think, that we were referring to, deaths from COVID-19 with no other underlying cause. We'll come back to that one in a minute. We used data from this one. To be fair, we didn't use data from this. We used the extrapolation of the data from that because that's actually the raw data sets. And of course, great to see that the Office for National Statistics rightly is publishing the granular raw data. And we noticed that this was a problem with certain vaccines and therapeutics as identified by the British Medical Journal yesterday. So full marks to the Office for National Statistics. Absolutely wonderful. And we've done nothing but sing their praises all the way through this pandemic, to be quite honest. They've been absolutely brilliant, which of course is why we use them. Then we looked at this, national life tables, life expectancy in the UK, 2018 to 2020. That is what we looked at. And then if we actually go on and look at some clips from the video itself, where are they? They're here. It's clear that we put this well into context on the video. So there we clearly said 127,704 excess deaths above the 5-year average. That's a screen clip from the video. And we did point out that many people think, and we clearly pointed this out, that many people think that this is the best way to measure deaths, that these are 127,000 deaths above what would be expected for the 5-year average. and we pointed that out in some detail, with some emphasis, it must be said, on the video. Then we pointed out the daily deaths at the time, of course, that's sadly slightly higher now. Deaths within 28 days of a positive test. Again, the UK government data from the site we've just looked at. So we were quite clear at the time when we talked about this figure here, and we put that into context. So to say that I'm saying the deaths were only 17,000 is not really quite what we were saying. And then we had deaths within 28 days, deaths on, where it's mentioned on the death certificates as a contributory factor, as opposed to the 17,500 deaths or thereabout that we are talking about as being the sole cause. And of course, this is the actual data here that we need to see. And we'll have a quick look at this now. Diabetes remained the most common pre-existing condition amongst COVID-19 deaths in England and Wales between October and December 2021. So this is the data we looked at. Well, we've clarified. We didn't actually look at this data on the video, but we've clarified it many times before and since. Proportion of death certificates where the death was due to COVID-19, that had by top 10 the pre-existing conditions, the comorbidities. Now, I started talking about comorbidities and explaining this in January. Was it January? It was probably probably early February 2020, when we started getting the very first data on comorbidities from China. That's how long we've been talking about this. I'm just full of incredulity here. Anyway, so diabetes we see is the most common, chronic lower respiratory disease, high blood pressure, diseases of the urinary system, which would include renal disease, ischemic heart disease, where there's not enough blood supply to the myocardium of the heart, signs and symptoms of ill-defined conditions. So this is other people with a variety. This could be called others, long-term causes of chronic ill health. Dementia and Alzheimer's disease, heart failure and complications and ill-defined heart disease, where the heart rhythm is abnormal, cardiac arrhythmias, better called dysrhythmias, malignant neoplasm of lymphoid, hemopoietic and related tissues. In other words, that's basically people with blood cancers, malignant neoplasm of lymphoid, hemopoietic and related tissues. They don't seem to have a separate category there actually for other malignant disease. Interestingly, presumably it's below the top 10. And then finally, the group we were talking about, COVID-19 cases with no pre-existing conditions. That group there, and as we said, that was about 17,500 or so from what remember. And that is percentages, those terms of percentages. So we really couldn't have been clearer on this channel about comorbidities. If I haven't made that clear, then I unconditionally apologise for being such a rubbish communicator. But that's always what we've tried to communicate. Now, and just out of interest, all that data is readily available here. On, I think, yeah, that's live there. So you've got the hospitalisations. I mean, they've got fantastic, so accessible levels of data from the Office for National Statistics, which is why we've used them repeatedly, absolutely repeatedly. So there we say antibody positivity 98% in England. Anyway, we could stay there for ages because it's such interesting data, and I'll put the link there. Do explore it for yourself, of course. Don't take my word for it, as we've always said. So there's a few links there. Click on them for yourselves. This was the actual Freedom of Information request data, which we did look at, of course, because that's what we were talking about. This is the account that mainstream media hadn't picked up, to the best of my knowledge, at the time I made the video, which is what we were talking about. So this is 2020, where it was the only known cause on the death certificate. That was the first quarter of 2021, January, February, March, April. That was second quarter. That was third quarter. And I think the data might be just out for the fourth quarter now, because so we'll look at that as soon as we can. But we didn't have it there. We didn't have it on the original video. But you add those numbers up and you get the sort of figures that we were talking about, where COVID-19 is the only identified cause on the death certificate. I mean, just to be completely clear, the people with diabetes and the people with heart disease would have carried on living for more years or decades. That's why we stress the excess deaths. The overall excess deaths, I believe, is the most reliable indicator, as we've stressed repeatedly on this channel. And if people don't think this is data driven, then please switch off now and go somewhere that is, because what we're trying to do is explain the evidence. That is what we're trying to do. Now, the BBC did mention it's become a weapon. This disinformation has become a weapon of the cruel and heartless to dismiss the deaths of people we love. So that's a direct quote from the BBC article. Now, the idea that I don't take death seriously is, well, I've been sufficiently unfortunate, or indeed you could say immensely privileged, since I was 18 years old. First person I looked after who died when I was 18 years old. I remember, I'm not going to say the names, but I remember the three people concerned. Well, these things are branded and seared into your memory. I remember their diagnoses, I remember their approximate age, I remember their faces, I remember their names. When I was a first-year student psychiatric nurse, I had these three deaths of patients during my care. And I've sat with patients many times as they've left this life by the bedside, by the emergency trolley, on a bamboo platform in a refugee camp. The idea that I would take human death lightly or use it as a... You get the message. I'm not going to go on with that. Now, the BBC has contacted Mr. Naswaz, possibly, I don't know. Mr. Davis, I did actually talk to Mr. Davis this morning. David Davis, Member of Parliament, of course, former Cabinet Minister. The BBC did, in fact, contact Mr. Davis, but he was too busy to talk to them at the time. Now, unless there's someone out, another Dr. Campbell, it says the BBC has contacted me. Well, as far as I'm aware, they haven't. It's not accurate. I have not been contacted by the BBC. I've been trying to contact the BBC for years. Well, at least for 2 years, I've been trying to contact the BBC to correct them on some points, to discuss some points, to clarify other points, without success. And I've actually passed personal messages on to senior people in the BBC, and I know the messages got there because I trust the people that were delivering the messages, and they've never contacted me. My channels of communication are well and truly open. And to that end, so Rachel Shara, health and disinformation reporter who wrote this, I've actually contacted Rachel this morning asking for an interview. So far from this intimation here that I've been contacted by the BBC but I'm hiding in some sort of corner somewhere, no, I will come on the BBC anytime and discuss these matters, and I'm very open to being interviewed. I would deeply like to be. So Rachel, please, I've sent you a message. I won't say how I've sent the message, but you will get it, for sure you'll get it. It's just via an electronic medium. Please contact me and let's discuss this. Because I think we both want to fight disinformation, don't we? So, COVID-19, latest insights and deaths, that's the thing we looked at now. No, I guarantee this is 100%. This is 100% coincidence. Before I saw the BBC had made that comment about me, I had actually prepared this from the Pope. Information based on scientific facts is a human right. I got this from the New York Times last night. Honestly, this is pure coincidence. I had prepared this before Pope Francis. To be properly informed, to be helped to understand situations based on scientific data and not fake news is a human right. You know, I remember when I was a student teacher, there was Paulo Freire wrote a book called The Pedagogy of the Oppressed, which was quite influential at the time, about the idea that people can be kept in subservience via a pedagogical education approach, which is, well, if you know what pedagogical means, most of you. It means sort of where I say, right, you lot sit down, shut up and learn from me. I'm the great teacher, which of course is exactly what we don't do. We take what's now called, won't digress into education. We contrasted it at the time with andragogy, which is the adult approach to education, which I hope we're doing now. I hope so. I agree with the Pope. I'm not a Catholic myself, but I agree completely with Pope Francis there, and I think that's really quite a profound comment for the pontiff to make. Journalists and scientists should try to build bridges to those who need to hear scientific truths. Now, implicit in that statement there, and it delights me to hear this, is the Pope is not saying there's such a thing as scientific truth, because it doesn't need to. It's just presupposed there's such a thing as scientific truth. And that's what we're trying to elucidate, the nature of reality. So pretty powerful words here from the Pope, really. Pope also lauded those who could properly place individual facts in a broader picture, which, of course, we would completely agree with. Facts need to be taken in context. By explaining the causes and circumstances of a given situation, which is what we try and do. Our World in Data has recently noted that 10 billion vaccine doses have been administered globally. Now, what is the population of the world now? I think it's 7.8 billion. So, enough for one each plus a few to spare for second doses. Now, Professor Pai, epidemiologist and biostatistician, McGill University, Montreal, has basically... the background to this is, again, New York Times I've just been reading. I have no financial interest in that journal, that paper. It's just what I've been reading the last couple of days. South Africa, for example, has set up a hub to begin developing mRNA vaccines, where scientists are trying to reverse engineer the Moderna vaccine from scratch. Now, that would take some doing from scratch. And the New York Times, direct quote, because the US drug makers won't share its technology. And Dr. Pai likened this to reinventing the wheel while the car is on fire. And let me just play you a clip from Dr. McKester from... I'm sorry, sir, I pronounced your name wrong. We'll just play a clip. Back might play it twice.
In one of the journals, and they were saying that the Omicron variant is the vaccine that we failed to make.
Yes.
In other words, everyone is getting it.
Is getting it, yes.
Not having any serious illnesses, but it's boosting the antibodies
yes.
To fight any other kind of COVID-19. So in other words, I think in the one of the journals, and they were saying that the Omicron variant is...
Omicron is the vaccine we failed to make. Interesting. So if there's limited amounts of pain, suffering and death in poor populations, it's not so much because of clever science, but because of the fact that Omicron has come along and is much less pathogenic, which is incredibly good news for many poor income countries. If Delta had carried on there, as we saw, do watch the full clip of that video. It was on just a couple of days ago on this channel. If Delta had carried on, there would be many more multiples of deaths compared to what there were. So there you go. That's what we're trying to do. We're trying to get across accurate information. I started doing that into the last century on these things. We used to make videos on those. Then we went on to these things. You'll recognise these. Then we went on to these things. What's that one? Brain AMP, an introduction to the brain and the skull. Then, of course, we went on to YouTube. So what we are trying to do is reflect the nature of science. So anyway, if the BBC wants to get hold of me, then I've sent that message. Let's do so, and let's collaborate. I'm not going to be so petty as to ask for an apology or anything like that. We need to go forward in this. And like the Pope says, get good information in, bad information out, and that's what we want to do. The nature of reality, if that's not too pretentious, but it's what I actually believe in. So there you go. And thank you for watching. If I get a chance later today, we will be doing the what we actually intended to do today, which was the differences between BA2 and BA1, Omicron variants, both Omicrons, of course. And the news is pretty good. The news is pretty good. So if we get a chance to do that, we will do it. Okay, thank you for watching.